Welcome to USMLE SARTI. We are committed to empowering IMGs. We're excited to guide you on your match journey. Don't forget to click subscribe and turn on notifications so you can get notified whenever we add new content. Also, follow us on Instagram and Twitter for the latest tips and tricks regarding everything USMLE. Now, let's dive into it.
Morning, good afternoon, good evening, everyone, depending on your time zone. So this is the USMLE Sarthi team, and today's webinar is all about US clinical experience. So this conference is spread over 2 days, today and tomorrow, same time. Today we are going to talk about US clinical experience, tomorrow about research. And what we have is a very distinguished panel. These are either applicants who have already matched, so pre-matched in the season 2024 or matched before, so maybe 23, or are going into the match 2025. But the common thread is all of them have had extensive US clinical experience. Now, you'll hear from a variety of the speakers about the importance of US clinical experience, how many months you should do it, inpatient versus outpatient, on-site versus tele, use of EMR, and how do you use that in the interviews, and a variety of topics around US clinical experience. So that's the agenda for today. And from a housekeeping perspective, Sarthi's team is there. We'll be coordinating this. And agenda was posted on Telegram and all, but we'll first start with, I think the first thing on the agenda is about EMR. Then we'll talk about inpatient and outpatient rotations. Then we're going to talk about the letters of recommendation and importance of ECFMG certification. Then after that, we're going to talk about tele-rotations and do they actually matter and how to make it work. And then important do's and don'ts about USCE. So, coming from outside US, many of us are not aware of the US healthcare culture, and we make mistakes. So the do's and don'ts of that. And finally, well, not finally, but challenges for an IMG. So day in the life of an IMG, that, and finally the ideal timeline. So for those of you going into the season or going into the match in 2025, what should you expect? When should you start doing stuff and things like that? So that's the agenda. We think it'll take about 2 hours. So you will get a lot of useful information today. And like I said, we will be monitoring the chat, but listen to the speakers. It'll be very useful, and then we'll take questions in the chat as well. So with that, I am going to invite the first speakers, which is Desiree and Aditya, and they're going to talk about EMR, electronic medical record. What are EMRs? How are they useful in your USCE? Should you know about it? And then finally, how do you use them in your interviews and to distinguish yourself? So with that, let me give it to Desiree. Desiree, why don't you kick it off and introduce yourself, and then we'll go from there.
Yes, absolutely. Hi, Pawan. Hello, everyone. Welcome, welcome. My name is Desiree Marquez Santos. A little bit of background about me. I'm a foreign medical graduate from the Philippines. So I graduated in 2014. Shortly after that, I worked as a general physician in my country for several years until 2017 when I immigrated to the United States. And I've been working in the medical field over the past 4 years. I've been working at a primary care clinic. In 22, I decided to pursue my USMLE, took my steps 1 and 2, did my rotation, research about programs, and then I applied to family medicine programs this season, and I'm happy to say that I was offered the pre-match position. So very excited to start my residency this July. So today I am invited to talk about EMR. And is it important? Do we need it as we apply in residency? And My short answer to that is yes, absolutely. It is very important. And very briefly, I will talk to you about some of the reasons why I think it's very useful and important. Okay, so EMR stands for Electronic Medical Record. Okay, and it has a variety of functions, variety of uses. Okay, number one is for documentation. EMRs serve as a digital platform where a provider can document everything about the patient. That would include the patient's history, laboratory findings, physical exam findings, treatment plans, follow-up plans, etc. So in essence, it's like a comprehensive digital record of a patient care, which it also helps in facilitating communication among the different members of the healthcare team. So that's number one. Second is information access and retrieval. So EMRs allow access for patient information, including results of blood work, imaging studies, and even past medical records. For example, when a patient is transferring care from one provider to another, EMRs make it easier for us to obtain their past records because everything can be retrieved electronically. We do not need to wait for actual physical copies before we can obtain all those. Then third is clinical decision-making support. EMRs also have certain tools and features which assist physicians in giving informed decision when it comes to best patient care. I'll give you an example. When we're trying to prescribe something to a patient and there is a potential for a drug interaction or an allergy to that particular medication, the EMR would alert us of such. And so in essence, EMRs help promote safety by minimizing those kind of medication errors. Fourth is communication and coordination of care. I've already talked about that before. It helps facilitate communication among all the different members of the team. That includes the primary care doctors, specialists, nurses, MAs, physical therapists, and every single part of the team. And finally, patient engagement. So EMRs also have this feature they call as patient portal, wherein the patient can send messages to their provider. They can also schedule appointments. They can check the results of their blood work. And so in that way, I think EMRs help empower patients to be more proactive about their overall health care. Now, those are some of the things, and in no way are they exhaustive, but I think are some of the things why I think EMR is very important. But it's not enough to know that. It is even more important that we know how it works and how to use it. And so the way we do that is, of course, by obtaining US clinical experience. And I'll end my part of the talk by saying that, especially nowadays, when it's getting extremely competitive to get into residency, it is of significant importance that we obtain US clinical experience. Not only will it help you be more familiar with the system, but also it will help strengthen your overall profile, your overall application, and likewise will show that you're committed, you're willing to invest time and effort into learning, integrating knowledge, and understanding the healthcare system here in the United States. So, yeah, that's everything I wanted to share about the EMR and the USCE. I hope you guys learned something.
Thank you, Desiree. Follow-up questions. You did do telerotation with Dr. Saad, if I'm not mistaken, right? In FM.
Yes, I did. I
And
actually
that
did.
had remote EMR. Did it have a remote EMR?
Yeah, so at that time, I didn't have an option. Well, I do have options, but I wasn't physically able to do an in-person rotation. And good thing Sarti had an option for a telerotation. So that's what I did. I enrolled in a program in a telerotation. I did that for initially 4 weeks, but that extended to 6 weeks. And that was truly very helpful because, I was really able to do direct patient care. I talk to the patients by myself. It helped enhance my clinical decision making, truly very helpful in my overall application. Yeah.
Thank you. And that is something, I want all our audience students to know that even in remote or tele rotations, there are rotations where you can access EMR, manage the patient. So EMR access can be done remotely as well through VPN. But thank you, Desiree. Before I move to Aditya, Aarti wanted me to remind you all that we will have pop quiz questions during the presentation, just to make sure that we are all listening to our speakers. And people who get the first right answer for various questions, they will get discounts. So if you are going for our rotations or research, we'll give you a discount. All right, so here is the first question based on what Desiree said. I think she named 5 uses of EMR. So anyone who can list down 5 uses of EMR, what Desiree said in the chat, the first person, or at least the 4 out of 5 correctly, Aarti will grab their emails and you'll get a discount if you do our rotation. So list at least 4 of the 5. Okay. Meanwhile, all right. So Aarti, you can see someone is, and toward the end of the talk or end of the session, we'll grab your emails. Okay, so stay till the end. That's what I want to say. Aditya, over to you now. Aditya is also going to talk about EMR. So Aditya, why don't you start with your introduction and then we'll go from there.
Okay, so hello everyone. I'm Aditya. I'm still a medical student in India. So I'll be graduating next month and I'm applying for the 2025 match. I'm done with my step 1 and my step 2 is also there in 2 months. So I did one since Desiree covered most of it, I'll be talking mostly about my experience. So I did one tele-rotation with Dr. Saad and one inpatient rotation in Beaumont Hospital, Dearborn. So in both the hospitals, we had EMR access. And in Dr. Saad's clinic, we had a remote access using Skype and a second screen where we were given the remote access. So in that, we had a chance to type our own notes in their format, which is SOAP, or the SOAP notes, which is subjective, objective assessment and plan. So in that format, we were given access, and then once we are done with the patient interaction, any doctor would come and sign it off. So in that way, we would know the previous history or what dose of the medication was the patient taking earlier, any other past medical history, any surgical history, or any precautions we must take before prescribing the medication. And since it was also an addiction medicine clinic, the EMR had a very specific access for the, the drugs such as buprenorphine, which are not prescribed over the counter. So it's easier in a way to access that. And since I'm not done with my interviews, Desiree already covered about that. And in the inpatient rotation, we were given computers, we were given access from one of the preceptors. So in the same way, we can access all the data. And I feel that is very important when you go and talk to the patients in the hands-on rotation, which I did. So the previous history is very important. And also you can go through many tools which are there in the EMR, which are useful in prescribing and also watching out for any other problems. So that's it.
Thank you, Aditya. So you are going into the match in this coming 2025 season.
Yes.
Okay. All right. Well, thank you. I appreciate it. Quick question. Did you do a tele-rotation? No, you did not do Dr. Weissman's tele-rotation. Okay, you did Beaumont and... All right. Any questions for Desiree or Aditya? So if you have questions, put it in the chat. And I do have another pop quiz question for those of you who are listening. Aditya did tell the SOAP acronym. What is the full form he gave? He spoke about, what SOAP is. With reference to patient notes, I don't want the SOAP after match. That is supplementary offer and acceptance program. Okay, so the first one will get the, and I think, yeah, okay. All right, Aarti, grab the first one.
We got the winner. Yeah, we got the winner. Yeah.
Okay, thank you. Thank you, Aditya. Thank you, Desiree. I appreciate your time, and let's see if there are questions. And as we move on to the second speaker, which is Sagar. And Sagar is going to talk about the importance of inpatient and outpatient rotation. But before I do that, I think I do have a question, Desiree, especially to you. The EMR and how comfortable were you? Did these come up in the interviews at all?
You know, I may not be the perfect person to answer that because I have plenty of scribe experience. So even before I started my rotation, I already had experience. So I had experience with at least 3 different types of EMR. So I felt, well, not say really 100% comfortable, but I say I had a fair amount of comfort when I started my rotation. But even though you did not have any type of experience before, you do not need to worry about that because there are some other students which will help you with your transitioning. So yeah, everything is they all have it set up perfectly for you guys.
All right. Thank you. Thank you very much, Desiree.
You're welcome.
All right, so Sagar, over to you. And I know you did about 3. So why don't you tell us about your rotations, where all you did first, and then about the inpatient, outpatient, the differences between inpatient and outpatient rotations, insurance needs if you do inpatient, and what actually is USCE?
Okay, so hello everyone. This is Sagar Mode. I am an intern in JJ Hospital, Mumbai, and I completed most of my internship, and then I took a 3 months of extension. I went to the US and did 3 rotations over there. So the first rotation that I did was with Dr. Atut in Hackensack Hospital, and over there we were rounding in hospital as well as we were doing the inpatients as well, inpatient and outpatient both. That is a mixed rotation. So overall, the main difference between inpatient and outpatient is for inpatient rotation, you just go to the hospital and round with the attending. So basically you have to be on time for inpatient rotation because if you miss the attending and the attending goes on rounds, then you are done because you cannot call the attending and ask where are you and which floor are you or which patient are you on. So you have to be definitely on time. For outpatient, you have to be on time, but it is more strict for inpatient that you have to be on time. Then in the benefit of inpatient rotation is the LOR is obviously more valuable compared to outpatient, but inpatient rotation, you are in very close contact with the residents. So you can network well with them. And if you have a good rapport with every one of them and you can ask for tips, how did you apply and what did you write in your CV or what did you write in your SOP or something. So inpatient, this is I think the most benefiting thing. You are in very close contact with the residents and you get a proper idea of what you will be actually doing when you are a resident. So that is the biggest difference in outpatient and inpatient. But on the other hand, outpatient rotations usually give you a very hands-on experience because the third rotation that I did was outpatient with Dr. Killen in Brooklyn. So there we used to do we used to call the patient in and then write all the SOAP notes, as Aditya mentioned very well, subjective, objective, assessment, and plan. Basically, subjective is what the patient tells you. For example, if a patient tells you that I had a fall while walking up the subway stairs, so you just put in the patient complains of a fall while walking up the stairs, and you ask them further questions did you feel any dizziness or was it a physical just a fall a mechanical fall or something. So you just put all of these things in subjective. Objective is basically lab reports and the imaging that happens. And then you can, for the assessment is actually assessment is the comment that you give as a doctor. For example, if I'm seeing an anemic patient and his or her hemoglobin was I think 9, And then after like 3 or 4 weeks of treatment, like that patient comes to you and you see the hemoglobin levels of 11. So you just put like hemoglobin levels have changed from this to this on this date. So this shows that the treatment of anemia is going on well and the patient is benefiting from the treatment. So this is basically what is happening with the patient, and you as a doctor have what comment do you have on the patient? So this is assessment, and plan is basically the treatment that we give. So because this soap system is kind of new for us, like for Indians actually, because we don't use the soap system over here. So basically you need to get very like if you're equipped with the soap system, and actually once you start using it and get used to it, you will think that you'll feel that soap system is really good because it like helps a lot in like assessment and plan of the patient. So basically that. My second rotation was in St. Mary's Hospital. Dr. Nader Mahmood, actually he's a pulmonologist, and that was a really nice experience because over there I got to like they made an account for me on their EMR system in my name, and the EMR system that hospital uses is Epic, and the one that Dr. Killen uses is the Practice Fusion. So both of these EMRs are really good. Some EMRs are like, as someone mentioned, that like sometimes it is difficult to get used to the EMR system because some EMR systems are like very complex. But I did not have any problem with using Epic and Practice Fusion at all because those were like I think very easily navigating through. And basically, inpatient you wear scrubs and outpatient you wear like white coats with formals. So basically, there's a difference. If you have any questions, I will be happy to answer them.
So, Sagar, are you going into the match this year?
Yes, sir.
Okay. How was overall your match experience in the sense, what type of questions did they ask you about your USCE? I think everyone wants to know all that.
Oh, like this year, as in I'll be applying.
Oh, you will be applying. You haven't gone yet. Okay, I apologize.
Yeah.
Okay.
I'm doing my internship right now, so
Okay.
like it will be getting over next
Yep.
month.
Okay. All right. Thank you. If you have questions for Sagar, put that in the chat. And the pop quiz question for here is Sagar has mentioned at least two EMRs, two different EMR systems. So yes. So all right. Before even I ask, so Vineet gets the answer correct. Epic and Practice Fusion. So Vineet, at the end of the session, we'll grab your email. Thank you. Thank you, Sagar.
Okay, thank you. Have a good day.
Let's move on. And I think then the other important part of the US clinical experience is your letters of recommendations. Why are they important? And, what can you do to get good LOR? What are the various types of LOR, clinic letterhead, etc.? Then the other question which most of you will be facing is, fortunately or unfortunately, many of these rotations, because the physicians tend to be so busy, they will ask you to draft your LOR. It's not the ideal situation, but it's a reality that will happen. So how is that going to impact what you should be doing? All of that we'll talk in this next session. And this session we have Sivagami and Sri Mahati. So Sivagami, why don't we start with you? You have gone into this match. So let's start with you. Why don't you introduce yourself, and then we'll go from there.
Thank you, Mr. Pawan. So my name is Sivagami Rajan, and I am an IMG. So I graduated in 2022, and I'm currently applying for family medicine specialty, and I got 9 interviews. So thank you for having me here.
All right, so let's talk about the letters of recommendation and the importance of ECFMG certification that you want to talk about.
Absolutely. So we all know what letters of recommendation are. It's basically the letter which the physician gives after we finish the rotations. And I think that's really very important because it could make or break your application. So I think that is the level of importance for an LOR. And I'm really thankful because The rotations I did from SARTI, I was able to get my LOR on time and I was able to submit it because there were complaints from some of my friends who did not enroll in SARTI and they did the rotation, they did not get the LOR. So I kind of recommended them to go into SARTI because I was very, very happy with what I received in terms of the LOR. So that's about it. And LORs are really important, as I already mentioned, because there was in one of the interviews I had this physician attending who interviewed me. She specifically told me that she chose me as an applicant for her program because my letters of recommendations were very, very strong. It was strongly tied to family medicine. So I highly recommend people who are applying to get their LORs from the same specialty they're applying to. For instance, if you're applying to family medicine, try to get all your LORs from family medicine. That has a very, very strong impact in your application. And as to the second question, ECFMG certification, that's really important because last time I did apply last year and I got very few interviews because I wasn't ECFMG certified at the time of application. So it got delayed by a couple of months and then I did not receive a lot of interviews. But this time I did obviously get all the documents on time. I was ECFMG certified and the number of interviews are obviously significantly higher. So I definitely recommend being ECFMG certified before applying. That's going to save you a lot of money. I did waste some of my money, so I don't want you guys wasting your money. So I thought it's really appropriate.
Yep. So since you did apply this season, what type of questions did you get on your USCE?
Absolutely. I think most of the interviewers actually asked me this question because I'm an IMG. So they wanted to know what kind of clinical experience I had in the US. So most of the questions were very general. They just asked me, how was your experience doing your electives in the US? And how was it different from the place you practiced at? So that is in India. So, and it was a basic, straightforward question. I think it's really very important to keep your answer very, very specific rather than generalized. So, for instance, if they're asking me what is my experience, I would recommend that you make it like a story, something really very personalized, so that if I switch your name and put somebody else's name, that wouldn't fit because the story is unique for each person. So, for instance, I told that I was doing my medical school in India and I wanted to do something different from my friends. So I packed my bags, I came to the US and I started doing my electives and I learned so much. So basically, nothing, just like a story, which keeps them engaged, but at the same time makes it highly specific. So I think that's really important while framing your answers.
Yeah. Thank you, Sivagami. Now, did you do any tele-rotation?
I did, Mr. Pavan. I did do a tele-rotation with Dr. Saad.
Okay.
And yes, it was like a good experience for me. As people already mentioned, I had access to the EMR, and also it was an addiction clinic, so that was really, really different for me. An interview did ask me about the addiction clinic, which I did, and yes, it was a great experience.
Okay. Thank you. And I am seeing questions in the chat. We are going to take it. So someone, I think Jayant asked Aarti, how can we enroll with USMLE Sarthi in booking rotations and finding contacts? Well, finding contacts is we do talk about all of this in our match classes, but Aarti, you can probably send them the link to book time with your team and the link to the rotations as well. So I think probably that will help everyone. If you send them the link to set up time with your team, that may help. Importance of tele-rotations in pathology. So we do have a session on tele-rotation. So, if you want to hold on to that, but yes, pathology is very open to tele-rotations just because of the nature of the work. And we have had many students who have done pathology tele-rotation, and you will hear from them as well. So just hold on to that question. So Sri, let me now go to you, and why don't you talk about your experience in the USCE space and how, because you you were in the US, so you've done, I guess, all on site and in pediatrics. So about the LORs, about some of the other aspects around the letters.
Sure, that's awesome. So hi everybody, my name is Mahathi. I'm a pediatrics applicant for this season and currently waiting for match day. So yeah, it's kind of tense around here. But I think definitely, so when we apply to the ERAS, usually we are allowed 4 letters of recommendation, right? So these 4 letters of recommendation, as Shivgami said, can make or break your application, because until then, you're just a file. So you're just a bunch of scores, you're just a bunch of research papers, and also you're pretty much, besides your PS, they don't know you. They have not met you, and you might not even meet your program directors or assistant program directors until the day of your interview. So I think that like an LOR per se is what gives you what gives the program director access to you in terms of how you work or how you are as a person. Because up until now, we were medical students, right? So we, our major job was to, go through exams, get papers done, so on and so forth. So so a letter of recommendation basically tells you the story about how you work as a person. It could be with, your auxiliary staff, such as your nursing, your medical assistants, your respiratory techs, or it could also be with people such as your colleagues, other departments, your seniors, your attending, so on and so forth. So in order to get like a strong LOR, I think the person that you've rotated with or your preceptor is someone that you should like look up to and follow with, and be very interactive, because then only will they understand how passionate you are about a certain specialty, you could say. And coming to like the different types of LORs, you have your university LORs, you have your hospital letterhead LORs, and you have your clinic LORs. So obviously you can tell university LORs would probably be the best, right? Because it's the strongest, and also because they have an attached medical school or medical facility with them, and they go teach students throughout their whole time. That will definitely help you stand out. But again, don't rule out clinic LORs, because if you've worked closely with, your provider would probably be a board certified specialist in their specific field. So if they can give you a strongly worded LOR, you can like if you show enthusiasm throughout their rotations, I think you definitely have a chance of, putting forth your best foot into the application. You can also say, as they had previously mentioned before, some program directors, some physicians allow you to write your LOR. And I think that's actually more of a good thing than a bad thing, because you, right? You know how you work. You know how what are your characteristics, what are your strengths, and what are your weaknesses. So that definitely, given with their opinion, I think you can incorporate into your LOR to make it more strong and more personalized as of for the application.
Yeah, there is, so that's a good point. I think as long as applicants are aware that there's an issue with the writing style also. A student writing his or her own LOR versus an attending with a 20-year experience, the writing style is completely different. So just be aware of these things if you're writing your own LOR. And as she said, the other speakers have also mentioned it. The more specific the LOR, the better it is. Generic LORs don't really count for much. So whether it's the clinic or the university letterhead or affiliated hospital, the more specific the LOR is, the better it is. So Sri, in terms of your USCE and the type of questions they asked you about the USCE, because you did, I think you did 2 rotations with us. So what were the type of questions they asked you in the interviews?
Yeah, one of the questions was similar to what Shivgami said, like what compare and contrast your, medical school experience to how US clinical experience was different for you. And the other thing would probably be so some of the attendings that I actually interviewed with, they did ask me specific parts of my LOR. So that were written by me and then edited by the attending, as well as the one that was written by the attending itself. So I mean, to pick out something from your LOR, I think is a very, you could say like they actually read through the LOR to see what kind of a person you are, outside of your ERAS profile. So I think that that's also very important, and it feels good for you to know at that as well, because you can see that the program actually cares about you and they're very interested in what you have to say. So I think those are some of the points that I did come across during interviews.
Yeah. Thank you very much, Sri and Sivagami. So any questions which are not answered, just put in the chat if you have specific questions for our speakers, and we'll get to them. All right, so the next session, and thankfully we are on time, and that's great, is about tele-rotation, specifically tele-rotation. So we have two speakers, Monica and Anushika, who are going to talk about it. So Monica, let's go to you first, and talk about how you used tele-rotations, or maybe even other rotations.
Yeah, sure. My name is Monica Sahotra, and I born and brought up in India. And I did my graduation from Ukraine in 2013, and I moved to the US in 2019. And I have applied for residency this year, and I got 7 interviews in internal medicine. So yeah, and thank you so much, Pawan, for having me here today. And yes, I would be so glad to help my fellows today. So about my tele-rotation, yes, I did my tele-rotation with Dr. Jane in Scardale. And that experience, I got my own EMR access. And for the first week, I got complete training to get comfortable with the EMR system and how to approach to the patients through telemedicine. And Dr. Jane and his team really helped me through that. And I remember Dr. Jane used to FaceTime me while having a consultation with his patients so that I could hear and see what was going on that time, of course, after obtaining the patient's consent. And at the same time, I used to take my notes and I write the HPI. HPI is a history of present illness, HPI from my EMR access during my tele-rotation. And after each consultation, Dr. Jane and I used to discuss about each case in detail, and that was the best part. And we used to discuss different differential diagnosis by using our critical thinking, which really helped develop my knowledge. And I got to learn different differences in the healthcare system in the US. And yes, after 1 week completion of my training with the EMR and with the patients, I used to call the patients by myself and I used to take their history in detail. And I used to write the HPI part, and I took part in assessment and plans at that time. And that was really a complete hands-on experience for me. And apart from that, I used to call the patients to update them about their lab results. And if there is anything to worry about, I used to alert them. And I asked them to make an immediate appointment with the doctors if they need. And finally, yes, apart from that, I got the chance to teach my fellows, and which really helped me to learn new things and, of course, gain confidence. And yes, and in the EMR system, if there is an alert and any important task to do, that always pop up on the top of the screen. And for example, some patients need immediate prescription, immediate consultation. So I used to solve that task by my own, and I used to discuss them with Dr. Jane. And yeah, that experience was really helpful for me. And after getting that rotation, I got a strong LOR from Dr. Jane, and that really helped me to make my CV strong to apply for this residency. Yeah.
And Monica, you also did quite a bit of on-site rotations, if I'm not wrong,
Yeah.
with in cardiology with Dr. Patel and at Loreto Hospital, and I think at
Yes,
So
at Hackensack also. Yeah.
yeah, why don't you talk and compare and contrast the on-site rotations and the tele rotations? You know, what were the different types of learning you got from on-site versus tele?
Yeah, sure. So I had a unique experience in each of my rotations. So telemedicine, my first hands-on rotation was a telemedicine rotation, and I would suggest people to do telemedicine rotation before going on site because it helps you to get comfortable with the EMR, with the healthcare system in the US, and makes you ready to go for the on-site rotation. And yes, the differences I found was in telemedicine rotation, I used to call the patients from my home at my own pace and at my comfort zone. So it was, yeah, and it like helps you to save some money from spending money from living and housing and everything. And in my Hackensack rotation was with PD, Dr. Atut and Dr. Weissman, and we used to like take rounds in the inpatient wards, and I also did the outpatient um, rotation with Dr. Atut, and I got the opportunity to work with the like residents in the ER, and I also got the opportunity to attend didactics with the residents. And by doing that rotation really helped me to get to know about the life of residents and about the healthcare system in the US. Yeah.
Yeah.
Thank you.
Thank you very much, Monica. Before we move on to Anushika, you know, if you are putting questions, put questions so that everyone can see, not just on the host and panelist pan. And some of the questions we'll take later on, like research on J1 visa versus H1 J1 and all that. So put those questions in the chat, and we will take them later on. Okay, now let's move on to Anushika. She is a pathology applicant, and I know there were a lot of questions on pathology and telerotation. So she did telerotations, and so Anushika, why don't you introduce yourself, and then let's talk about your telerotation experience in pathology.
Yes, sure, sir. First of all, I would like to thank you for giving me the opportunity to help my fellow immigrants. And little bit introduction about myself. I am Dr. Anushika Mahen, currently working as a junior staff pathologist at Government Medical College, Patiala. I finished my residency in pathology in 2020. After that, I have worked in government and in private sector, both. And I am a pathology residency match applicant this year. So the only rotations which I did was tele-rotation in pathology from Sarthi. I did that. It was with my mentors were Dr. Judy Jackson and Dr. Jolene Abrahams, and it was at Palm Springs, California. What I find about tele-rotations is they were very feasible for me because I didn't had a visa at that time, and it aligned very nicely with my work schedule because it was in the early morning hours from 5 to 9:30 in the morning, and 3 to 4 days in a week. Weekdays were off. So those were the things I think tele-rotations are very good for candidates who don't have a visa currently and who cannot move to US, and it very well aligns with the study schedule and work schedule because I was working at that time. During that rotation, we used to attend the didactic in the morning. 1 hour didactic was there, and then interesting case discussion was there. It was done by Dr. Jolene Abrahams also, who was a pathologist. All the basics of pathology were touched, like histopathology, breast pathology, gynec pathology, cytopath, and hematology. All were discussed. And then the specific cases like oncology cases, those cases were discussed by Dr. Judy Jackson, who were double board certified. They were a radiation oncologist also, as well as a pathologist. So we got a comprehensive overview of the cases, and it was a very nice experience to remotely collaborate with physicians over the world. So another thing about that was at the end of the rotation, we had an opportunity to present a seminar. So we were evaluated on the basis of that seminar, and it impacted a letter of recommendations, because I think the more the more good the letter of recommendations we get for our application, it imparts a lot on our application. So when we interact with the faculty and we take the opportunities to present a case or a seminar during our rotations, that impact our CV also. So
Yeah.
this is.
Thank you. And Anushika, what type of questions or about your USCE were asked during the interviews?
Okay, during my USCE, first of all, it was asked, have you ever been to US? So I said no. Then about the tele rotations, it was specifically asked, please share your experience about the tele rotations. So I I told them what I learned during those rotations and how it was. We discussed the cases. I think in pathology, it is very good because we see the cases. We don't need much of the patient interaction. So from tele-rotation, it's most of it is covered. And during our tele-rotation, our faculty, Dr. Abrahams, they also used to show us about how a lab works in the United States, how like lab works. So those things at the end of the rotation, they also used to tell us those experiences, like how to work in. So it was a very good experience, like mixed experience.
Yeah. Thank you. Thank you, Anushika. So if you have any questions for Anushika, you can put in the chat. Our next speaker is Abhiram. And Abhiram, I think you are going into the match maybe next season. So he's done one tele-rotation with us with Dr. Saad, and he is doing a rotation, I think, on-site with the program director as well. And you've also done, I think, research with us. So why don't you talk about some tips for tele-rotations, how to prepare, how do tele-rotations work, how can it actually improve your CV? So some of this, if you want to shed some light on, Abhinav.
Yes, thank you. I would like to thank USMLE Sarthi for giving this opportunity first. I am Abhiram, Dr. Abhiram. I'm from Hyderabad, India. I'm an intern. So I have taken break now to come to the US for clinical experience. But back last year, I was finding it very difficult to get a visa appointment. That is when I took this tele-rotation with Dr. Saad in William Beaumont Hospital. So what in my tele-rotation, I had access to three main things, which was access to the patients directly through the video call. I had access to the EMR. I had access to directly to the physician as well. So we would talk directly to the patients, take their histories, write everything down in the EMR, and then present our case to Dr. Saad, and then he would give the diagnosis, and then we would discuss the plan. We would discuss what diagnostic labs to order and everything regarding to the patient, like to the treatment of the patient. So I feel because I did the tele-rotation after coming to US this year, it really helped me because I knew how to handle the EMR, how to write the history, write the plan. So I really would recommend doing a tele-rotation. And since COVID, tele-rotations have become important as well because it helps easy access to the patients. And then tips would be like treat tele-rotation as any other in-person rotation. Dress formally, be on time, and then have a good internet connection and have a good webcam. And yeah, that would be that. And yeah, yeah.
Sorry, go
Yes.
ahead. Go ahead.
Tele-rotation does improve your CV because you get to, in case you're not able to attend US due to any reason of not getting a visa or something, this definitely adds weight to your resume. So you do build contacts, you get direct interaction with the patients, you get a strong LOR if you do well. And yeah, so and in my rotation, the doctor has said that he's going to write the LOR by himself. So I'm hoping it would help me a lot.
Yes, absolutely. So I know we have a different session on this, but now you are in the US and you did first tele and now you're doing on-site. Have you started that on-site rotation?
Yeah, I'm done with my on-site rotation with Dr. Atut.
Okay, so just for applicants, who may be not in the US and planning to come here, what were your, I guess, differences that you saw, on-site versus tele, and how did you get used to the US healthcare system when you came on-site?
I think because my telerotation was like they gave me access to EMR, but compared to others who didn't have access, my other co-interns, so it was a bit easy for me to like start off. And you do have a lot of more exposure on in person because you get to interact with the residents, with the doctor more, and then you get to build more contacts, do more networking. And the Delhi, it was more time convenient because I was preparing for my step one. I was doing my internship. I could do that all during the day, and my telerotation was starting at 6 in the evening till 12. So it was better to manage. Now, it's a bit difficult for me because I have to prepare for step two and then do the work throughout the day from morning to evening. So that would be the differences, I would say.
So, would you recommend for someone who has never been to the US, has no idea of the US healthcare system, to start with a telerotation to get used to the system,
Yes,
and then
definitely.
they can be more productive when they come on
Yeah.
site?
Yeah, definitely you'll get a head start. You will be more confident because you know what their EMR system is, how they work there. So I would definitely recommend one telerotation at least because a lot of people in person, the doctors do teleclinic as well. So you do get used to that. Like that is what you're going to do as well. So you get a lot more advantage compared to a person who directly comes without any telerotation experience.
Okay, thank you. Thank you. So, if you have questions for our speakers, put in the chat and I will take a couple of questions. So if you want to change your tele rotations, just email our team. I see a question, so our team can work with you. There's another question, IMG from India, and you're moving to Canada. And for timeline, etc., you're starting your USMLE journey again. Aarti, maybe they can set up time with you, so we can help them. We will start mentorship on the USMLE steps very soon. So just send us an email and we'll take it from there. All right, so moving on, the next session, session 5, is on do's and don'ts in USCE. So things you should avoid, things you should absolutely do. And we have Dhruvi from our panel. She's going to talk about it. So Dhruvi, welcome. Can you introduce yourself and then talk about the do's and don'ts, and how IMGs can have a great experience when in the US?
Yeah, sure. Thank you, Pawan, and thank you, Aarti, for this opportunity. So I did one rotation, which was hands-on by Sarthi with Dr. Lazarovich, and I would start with. So basically, what a program director or attendings are looking for in an applicant. So as an IMG, they want to know how holistic of a CV you have, like how many months of rotations you've did, how were you at that rotation, how good are you at communicating, and what they really want to know is how well will you fit with their team. So like, are you going to be a good fit for the programs? They just don't want to know that, oh, you scored great so you'll get an interview. No, they want to, like, for as earlier it was mentioned that LORs can make or break your chances of getting into the match. It's very true, because when you are doing these rotations, they will see how well you can communicate, how well you are communicating with your team, how well do you work with your team and with your preceptor, how good you are with patients, and how good is your clinical knowledge. So all of those things come into play when you're doing a clinical rotation. So for the do's of a clinical rotations, you should definitely, like, suppose you're doing a rotation in internal medicine, so like the bread and butter cases would be hypertension, diabetes, CHF, and all of that, right? So they want you to be prepared, like as much as you can be, so you can communicate with your patient that what is their problem, what does this lab mean for them, and how you break the good and the bad news to the patient. It's not just how good you are, like on book, like on theories and all. You need to know how to speak with the patient, how to empathize with the patient. So that is a very big thing for the rotations which I've learned. And like for a lot of us in our med schools, we are really shy and afraid to ask questions to the physicians, like we don't talk a lot with our preceptors at our home schools, right? But here in the United States, the doctors prefer for you to ask questions, to talk to them, and like they want to know that how interested you are in the specialty, and how interested you are in treating your patients. And they will even guide you if you like talk to them. And like it can be the most stupidest question you are asking, but it does not matter, as like you are learning something from them, right? And that's what they want to know, that how eager you are to learn. Another thing for the do's would be like you should not be late, and always be on time. That just shows that you are committed to the program. Like it sets a good impression. You should always dress like neatly, and formals or scrubs, whatever the requirement is. If you're doing inpatient, it would be like in the scrubs. Outpatient would be formal clothes. It is how you present yourself that matters. It also helps build the trust with patient. If you are shabby and don't look great, like patient would think, why is this person here? What is like, what are they doing? And so it all comes into play there. Another thing about like doing USCEs is you get to build contacts. So what I mean by contacts is contact is someone that can root for you, or like send an email for you when you're applying for the match, that this person did a great job when I was there attending, or when they were rotating with so and so attending, I had a chance to speak with them, and I feel that they would be a great fit to your program. So when you are doing a rotation, like you should always try to converse with as many people as you can, so they can, like, you never know, help can come in any form. And like as an IMG, you need a lot of support to match. And it's a great way to build contacts. Another question would be like, to apply for USC, what sort of documents would you need? So the main thing would be your B1 B2 visa and immunization forms. They would need your TB titers, PPDs, and influenza shots are really important for at least for inpatient. You will need all of those, and I guess that's it. And yeah, another thing would be EMR. So when you are learning your EMR, it's okay to like be confused and all. There will be people who will guide you, but as you go along like your rotations in a week or so, it's really easy to learn the EMR. And your LORs would also mention that you worked with an EMR, like so and so EMR, Epic, or Fusion, as they said. So like that is something you will get to learn. But you should just be really eager to learn, and your preceptor should, like, you should have some sort of communication with them on like how you are doing, what is your goal, and what you want to do in the future. People here are really willing to help you, but you should seek it out.
Yeah.
That's that, yeah.
So, any things to avoid, don'ts of the USC, what should
Yes.
be avoided?
So I have seen some students be like overconfident, and they try to undermine what patient think and think they're better than the patients. And I've seen the attending physicians do not take that well at all. And like, I mean, they're right, they should not. And you should always have a level of respect with the patient, and you should never think that I know more than this patient, so I can say or do whatever I want. You have to treat patients with utmost respect, and you cannot be like, I know it, or like, I know everything, you don't know anything. That attitude does not fly here, because it just gives out the wrong message. It harms the patient physician relationship. So that is something people do not tolerate here at all. So that is a big red flag. Another thing about don'ts would be, don't like, yes, everybody would want their preceptor to know that how good their clinical knowledge is, but you cannot be like know it all and always, you will have these sessions where you are discussing a patient, and like, if a question is directed at a certain student, please let them answer. Do not jump in and answer for the student that no, I know it. And it just sends out a wrong impression, and that could also affect your LOR.
Yeah. Thank you. Thank you very much, Dhruvi. Appreciate these insights. So, are you going into the match in 2025?
Yeah, most probably, yes. I'm preparing for my step 2. Let's see. I mean, if we're getting good scores, I might give it before the math season and get ECFMG certified.
Yeah, good. Well, good luck. And
Thank
if you guys have questions for Dhruvi, put them in the chat. Now, the pop quiz question is, what was the first don't she mentioned about not to do in USCE, or about the behavior? She mentioned, some of the don'ts. Don't be late. Okay, I don't remember which one you mentioned first. So
Just don't be shy. Yeah, don't
okay,
be shy.
don't be shy. Okay, because I had something else in mind. So anyone who mentioned don't be shy, Aarti will grab your email and we'll go from there. But thank you, Dhruvi. Appreciate it. All right. So next up is Rishabh. Rishabh, has seen it all. He's applying to neurology, and he's going to talk about challenges for IMGs in general, day in the life. He has done rotations, he has done research, and quite familiar with the US system. So, Rishabh, over to you.
Yeah, good morning, everyone. My name is Rishabh. I'm from Punjab. I'm an ECFMG certified physician, and I'll be applying to neurology, as Pawan said. So today, actually, I'm going to talk about two things. First is what difficulties an IMG may face while doing his rotations, and the second is what rotations look like a day in life of an intern here. So first of all, there are going to be a lot of cultural differences. I want you guys to be professional and respectful to everyone around you, not just the doctors, even the patients, and all those little things that you do will affect how your attending writes your LOR. Second is, I've seen doctors from different countries have difficulty communicating with the patients, probably because of the language barrier. So if you're not a native speaker, it's good to brush up your communication skills before you come here. And another thing I want to tell you about is time management. I've seen students come here without give their step 1 and step 2. Now, obviously, you cannot just let go of any opportunity you might have, and doing rotations is important. But in case you're planning to give your steps while you're doing your rotations, you need to make sure you have a lot of discipline and that you manage your time accordingly. Apart from that, there's going to be a lot of time zone differences here and back home. You have to talk to your family, your loved one, and some days it's not just possible to do that because of the time difference. Maybe the schedule you have is not the same. So it might cause a little bit of stress, and you have to take care of your mental health and also make sure that you stay connected somehow. Apart from that, you have to understand that the US healthcare system is not the same as your home country healthcare system. You're going to have different new things that come up, like insurance and healthcare policies you need to be aware of, and making sure you are aware of those things and actually understand them. will leave a good impression with your attending and will also help you during your residency, right? So that's the thing I feel you guys should be aware of. And as far as a day in life of an intern or while you're doing your rotations here, it really depends on what kind of US experience you have. I want to really thank Sarthi team to making sure that the rotations we have with them have both inpatient and outpatient experience, because sometimes it's really hard to get an inpatient experience here. And most people just end up doing clinics and having no exposure to the hospital environment. So while you are having your office rotations, your clinical rotations, you are basically taking history of the patient, doing physical examination, taking vitals, and answering some questions that the attending may ask. But during inpatient, you not only do rounds, you actually, you have more time to interact with your attendings because the rounds may last longer. And you have time to attend, interact with your residents and different faculty members, not just sometimes even the program director. I was actually happy that with my Hackensack rotation, I got a lot of time to interact with Dr. Adam Atut, who's just an amazing program director. And usually most rotations, you do not even get to see the residents, but there we had didactics where we used to, interact with the residents and actually study with them. So it was a great experience. And apart from that, you also have to make sure that you are, thorough with your clinical examinations, because sometimes you got to do that when you're rotating there. And all these little things make a lot of difference while you're getting your LOR. So yeah, that's it.
So Rishabh, that was mostly very useful on the medical side, the healthcare side, but day in the life also about, say, logistics. How do you in general manage going and coming from the hospital? What about cooking? What about other things? Things are very different in this country. So what are your tips? What have been your experiences on all of that?
Yeah, this was the most difficult part for me. I've never lived alone. And in US, you have to do everything by yourself, from cooking to, you cleaning your house, doing your laundry, everything you gotta do it by yourself. So that was a kind of culture shock for me. It wasn't easy initially, and I was very stressed. I was like, what am I doing here in India? You don't gotta take care of all these things, right? So that was pretty intense. And I think it'll be helpful to come to rotation with your friends, bring them along so that you're not alone and you can tackle things together. Also, you got to be aware of your public transport. The Uber and Lyft thing is really expensive. I spent like hundreds of dollars initially. Like my first month, I had no like budget or management of my money. So I was just spending a lot on, commute. So from second month, I started understanding the subway system and the buses system, and I started using that. That saves a lot of money. So yeah, you have to be aware of how you commute to the hospital. Make sure you try to buy place where you live, do an Airbnb, or use the Sarthi housing option. You can do that to have a place really near to your rotation so that you don't have to spend a lot on that. And yeah, and also keep communicating with your family, right? Because the time difference is a lot. It's like it can create stress sometimes not talking to you. For me, it's really important. I talk to my parents every day. So yeah.
Well, thank you. Thank you very much, Rishabh. Appreciate the insight. Especially, it's important to be aware of the public transportation in the US because most of the IMGs do not drive. The driving is on the other side of the road for most of us. So it gets, you need time to get used to. So driving is a challenge. It's important to understand the local bus system and the subway system. And of course, then cooking is another challenge, and cleaning your own apartment, etc. So there are challenges, and for some of us, it is a big shock. I personally remember when I came here as a student 20 years ago. I couldn't make my own cup of tea when I came here, and like life teaches you in this country very, very quickly. Within a month, you figure out a lot of things. So yeah, thank you. to some of the questions, we are not handing out any of the panelist emails. You have to go through Sarthi because of privacy issues. I'm not, giving you any emails. You have to go through the Sarthi system. We don't share emails. Obviously you are free to look up people, but please don't ask for our panelist email. And all our panelists, thank you. But if you need to go, feel free, as we can answer many of these questions. So, Rishabh, thank you. And the last session of the day is with Sangam. Sangam was a former Sarthi student, and he matched only on the basis of his tele-rotation. So quite an achievement. I mean, so Sangam, welcome. And why don't you talk about your tele-rotations and ideal time to do USCE, and is location important when you do your USCE?
Hi, Pawan. Thank you so much. It's really great talking to you, and thank you for this opportunity. So first of all, I'll say a few words about my tele-rotation. Uh, Unfortunately, due to COVID-related delays in the visa processing, I could not get my B1, B2 visa in time. So I wasn't able to do any in-person rotation in the US, and the only option that I had at that time was tele-rotation. And initially, I would say I was very apprehensive about tele-rotations. I mean, I did see patients over telemedicine, but doing rotations, learning, and b- using the EMR through tele-rotation, all of those apprehensions, all of those things, it made me very apprehensive. But the experience itself, it was really good. I love those tele-rotations. I learned a lot. In fact, I did Dr. Saad's rotation in addictive medicine. And when you are doing the residency in New York City, that does come in handy. So yeah, I did one rotation with Dr. Saad, which was a clinic-based outpatient rotation. Uh, I would say, you cannot call it hands-on since I was not there in person, but I think I did everything except for the general physical exam on the patient. We had remote access to the EMR, practice fusion. We would talk to patients. We would take history. We would document. We would complete the chart in the SO format. And then later on, Dr. Saad or one of the nurse practitioners, they would come in and um, close the encounter after prescribing medications and examining the patients. And the other two rotations, they were very similar. The one I did in Florida in a Advent Health uh, related affiliated setup, and the other one I think I did in UCSD with a hematologist who was really nice, and it was a great learning and teaching experience for me. And all the three rotations really helped me. I got really good LORs from there as well. And I think in that period, when there were no in physical, I could not come to the US and I could not do physical rotation. That was a really big help in matching to my program.
Yeah. So Sangam, you are from one of the top institutes in India, AIMS, and then you did tele-rotations. Now you are doing your residency. Many applicants who have not come here for USCE generally want to know what exactly is the difference. Is it any different, the US system and the Indian system? So, briefly, can you tell them what the difference is?
So I would say I mean, the US system and the Indian system, they do differ by a lot in terms of how they function. I mean, basic medicine remains the same. You have XYZ disease, you treat it with this ABC medicine, but it differs in how you treat the patient. So basically, the first thing is the workflow is entirely different, like the EMR. So entire work in the US is based on EMR, whereas in India, we have very limited EMR access. So everything you do is over the EMR. The second thing I would say is in terms of how we handle the patients. Like it's a very paternalistic approach in India, I would say, if not uh, which is not so in the US. Over here, like, whatever patient says is right. If the patient doesn't want a medicine, even if the patient is critically ill, if he has the capacity, if the patient says that he doesn't want treatment, like he doesn't want treatment, that's it. You cannot like go to the patient and tell him that no, you need to take this medicine. Like that's it. That's the end of discussion. So there are differences in how we round. There are differences in how uh, the the status quo with the nursing and the auxiliary health care staff. So there's a huge difference, and which you would not, sort of understand unless you practice in this setup. Uh, One of the, I think, the most fascinating things I found was sending medications to pharmacies. Right. So it's a very small thing, but it makes a huge difference. Like you send the medicine directly to the pharmacy uh, of choice, of a pharmacy of patient's choice, and they get the exact medicines that they need with writing on the bottles of how to take it, when to take it, how many to take it. Whereas in India, or I think in any other country, like you just write it up, you just write a prescription and give it to the patient, and you don't know if they are going to get the same thing or not, or whether they are going to get the instructions to take it properly or not.
Yeah, yeah. So you also mentioned about how this telerotation with Dr. Saad helped you or is helping you in your residency, maybe because of the patient load and maybe EMR experience that you got. In general, how are USCs actually relevant and important in the residency as students transition into residency? Uh, so talk a bit more about that.
Okay, so I would say let's take like Dr. Saad's clinic for example. So the clinics in the US are way different than the clinics from India. Like in India, if you are sitting in a clinic, say first in terms of number of patients, you see 70 patients. You barely spend 5 to 10 minutes per patient, whereas over here you need to spend more time per patient, at least 30 to 45 minutes per patient, and you need to have a very detailed assessment of the patient, everything from their problem list up to their immunization, whether they have had screenings done or not. And these things, like, these things also come into in the step exams, but you don't realize their importance till you actually see these things in action in the clinic. That, you have a question in your step exam about colonoscopy, about the age of colonoscopy, but you don't actually realize this when you're in the home country till you get here, about vaccinations, because all these things, they are done routinely and regularly for every patient that comes in the clinic. And that really helped me over here, like, because when I started my clinic here, so on day one, like, a patient would come in, then I would have to go through everything, like not just what his complaint was, and not just reconciling his medications, uh, his screening status, his vaccinations, what medications he took, what referrals we gave. So all those things, you can only understand that when you are here.
Yeah. Well, last question. As you are now in your residency, you must have seen other applicants also come in applying. Uh, have you seen location of the USC? I know you did tele, but otherwise, does the location of USC matter? Do programs look at that?
I would say, yeah, they do. Location, I think, in the US is really important because it's basically like if you are willing to do a rotation in, say, New York City, then yes, then I think the program take it as a marker that you would be more likely to take up the offer. That is one thing. The second thing is in terms of networking and connecting to the residents in the program. So let's say that in a city like New York, which has the highest number of residency program, if you do a rotation over here, you also have a lot more networking opportunity in terms of reaching out to residents of a program or reaching out to the program itself and finding even more clinical experience or observership or uh, clerkship opportunities in those programs. So compared to a place where you have only one or two programs in the city. Also, like, if you have an LOR from the same region, I think it matters more because they uh, they are like, if it's from a person who's in an academic program, most likely the other programs will recognize that, or even would know the person uh, by themselves. And so I think that would make a difference.
Yeah. Well, thank you very much, Sangam. Appreciate your time, and hope your New York stint goes well. So thank you. Thank you.
Thank you so much, man. It was a pleasure. Thanks for speaking.
One more thing, Sangam. Nice t-shirt. You have your own merch.
Yeah,
Sangam,
yeah,
nice.
it's actually a homegrown company.
Yeah. Oh,
Yeah, it's my brother's startup.
Oh, okay. Good,
that's
good.
good.
All right, let's take some questions as our panelists leave. So I'll take the questions, and a reminder that tomorrow also we'll have the same time session. And tomorrow we are going to talk about research. So let me take some questions, and then we'll wrap up for today. And tomorrow we can start again, same time, 11 a.m. Eastern on research. So first, there's a question: does the cost of rotation affect the quality? Why are prices different? So I'll take that. So for Sarthi's rotation, the prices are set up by the physicians. So sometimes they vary because of the location. Sometimes they vary because you may have hospital access and all that. So there are a lot of variations. The hospital letterhead versus clinic letterhead versus the specialty, tele versus on-site, and that's the reason the prices are different. Okay. Do all rotations have EMR access? I would say about 90 to 90% have EMR access. Some may not have EMR access. So if you're looking, so make sure to ask our team, or at least look up our website. When you read the description of the rotation, you can find out more about it. More insights about post PG journey to USMLE from India. So if you have a home country residency, the game changes quite a bit. You will still, for all practical purposes, need to be ECFMG certified. There are different paths to the US. One of them would be to direct enter into a fellowship if you have a home country residency. So set up time with our team, and depending on your profile, we'll talk about what may be more relevant for you. Can we go in for rotations in the final year? Yes. Most of our students, especially from India, what they do is they take a break in the internship, then they do their USCE. But I guess you could do it in the final year, although during the internship is fine as well. Most of the students do it. All right, let me see if we missed any other question. If we didn't, okay. All right, so that was all for today. Thank you all for joining. Let's reconvene tomorrow at the same time, 11 a.m. Eastern for research, and then we'll take more questions as well. Okay, so we'll see you tomorrow. Tutoring about step 1, etc. will start in March. I see the question. So we'll give you information on that maybe tomorrow. Have a good night, all of you. If you are not in the US, outside US, otherwise have a good weekend, and we'll see you tomorrow. Don't forget to join back for more insights tomorrow about research. Thank you.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.